My name is Christy Schulze, and I'm the Director of Clinical Counseling at Lawrence Technological University, and I wanted to talk to you about a pathway in behavioral health that people don't usually consider, which is working at a university counseling center. I'm really passionate about the job because I think it's like just one of the best things that you can do. So a little bit about me is that at Lawrence Tech, I work with both of my dogs. So on the left is Maggie and on the right is Willow. And I infuse pictures of them throughout the slideshow because they're my favorite. So you'll get to enjoy them throughout the little talk. So if you like talking to people about their life, if you like helping people find resources that might assist them, participating in things that support mental health or wellness, and as a bonus, you can keep calm in an urgent or crisis situation, college, mental health, university counseling might be a great position for you. So what is it that we do? So we work at a college or university providing individual therapy or group therapy for students, but we also serve the entire campus population by providing events that share mental health resources or information to the entire campus population. And the overall goal, the reason that the university hires us is because we are able to help students succeed both personally and academically. Why you would want to consider this particular behavioral health path. One of the nice things I think about working at a college counseling center is that it is accessible to all three behavioral health disciplines. So whether you decide to go to school for social work, counseling, or psychology, any of the three of those would be able to be used as a jumping ground into the college counseling profession. We have a great opportunity with this age group to be able to help students through major life transitions, but this is also the period when a lot of lifelong mental health conditions emerge. And so we're able to provide education and support and reduce some of the stigma that can come along with treating someone who has a mental health condition. And therapy in this particular stage of life can really help a person learn how to manage the stressors that they'll be experiencing on and off throughout their entire life. But basically, you're part of the support system that helps a student succeed while they're in college. So a typical week in college mental health, a lot of our time is spent doing individual therapy. So evidence-based treatments using different therapeutic backgrounds like acceptance and commitment therapy or behavioral cognitive behavioral therapy, any of those things we use to provide interventions for students in a one-on-one session. We also do group therapy. So some of the groups that we have that we have participated in, perfectionists, a neurodivergent support group to help the students learn both the strengths of being a neurodivergent, but also the challenges that they experience as a college student. They can learn from each other in those groups. Grief groups are pretty common on a college campus, student athlete support groups. And one of the interesting areas, one of the things that I think is kind of cool is at some universities, they'll have therapeutic tabletop role-playing games as a group. So the therapist works as the master of the game, the dungeon master, and they create with each individual person around the character that they play. They work with them to how they would like the character to encounter challenges throughout the campaign that they would do over the course of a semester or a year. And then they work that into the entire group. Each person has different goals that they want to achieve. And so it's a really unique way to tap into specialized interests that people have. But it can be really creative, and it can be something that ties an interest that you have outside of your work as a therapist into the work that you do at the college. And then one of the other things is outreach. This is really my favorite part. It's how we spread information and awareness about mental health to the entire college campus. So therapy dog visits on our campus, we have about 10 or 12 dogs visit once a month, and I facilitate those meetings and do the organization behind it. We'll do informational tables about alcohol use, depression, different things like that to just to kind of passively disperse the information about how to access our services, but about what that would look like if you were experiencing it. And then at the beginning of each year, we do a lot of informational presentations, trying to connect with as many of the new students that we have, just to let them know that we exist on campus, and also to let them know how they can access our services if they need them. And then the last kind of more active piece of outreach includes doing educational presentations and activities. So we do an annual suicide prevention walk. We do we've done things where we've helped students to make a sensory-based stress reduction kit. So we have different things like Play-Doh or hand lotion or fidgets, different kinds of candies, sour candies, that they can put into their sensory kit to help them, and then also help them brainstorm some other ideas about things that they could do if they're in a situation where they're feeling extremely stressed out. And then the last part of our job that's very important but doesn't happen quite as often is responding to urgent needs around campus for students who are experiencing a mental health crisis. So every single day is a little bit different. You're not going to see the same type of presenting issue with students. So sometimes you'll be dealing with anxiety, sometimes you'll be dealing with depression, relationship issues, and then you can do an outreach presentation, which is a little bit lighter and helps to kind of break the flow of the day. But really, realistically, every single day you get to experience a little bit of a different type of work environment. Like I said, there's no like you have to be a psychologist or you have to be a counselor in order to get into college counseling. I like to share that my bachelor's degree is actually in animal science and chemistry. So not related to behavioral health at all, but I was able to get into a graduate degree in counseling. That's where my master's is from. And as long as you have some experience and can talk to that, for most programs, you don't need to have a specific bachelor's degree. Things that I like to tell students who are maybe interested in going into this career is that if you take coursework in psychology or sociology, education type classes, public speaking classes, those are really helpful to giving you some useful skills that apply to what you will be doing in this type of a job. And then a doctoral degree is not required. It's only required for some jobs, but it could be helpful if you are interested in pursuing a leadership role at a counseling center, or specifically you would like to train clinicians in your role at a college counseling center. And then I just heard the other presenter also talking about some professional groups and as a way to stay on top of the most up-to-date information. And I'm really a big fan of that. These are also people that know more than the general person could possibly understand exactly what you're doing day to day and can be a support to you in the work that you do. So I listed out a couple of different options for groups for all of the different disciplines that could be helpful to connect with, to see, just to get an idea of what the background, the career progression, that sort of thing. And then if you have other questions or information, just want to talk more about the field itself, I would be happy to answer any of those things